In the Indonesian capital, oxygen is an increasingly precious commodity. As hospitals in Java run out of room for the sick, people fight for their loved ones to survive.
I had trouble finding oxygen last night. I went to 5 places, including this store and a large medicine market. All stocks ran out.
Minanti is trying to care for her elderly father at home. He's diabetic and has problems with his heart and kidneys. His oxygen saturation is low. But he could not get a place at Jakarta's crowded hospitals. Every day she struggles to find oxygen for him.
The tank is super difficult to get. We borrowed it, and then suddenly the owner said they needed it back because they also got COVID. We looked around and got this big tank, but it's difficult to refill.
This public health clinic in Bekasi is trying to reach those who couldn't get admitted to hospital. But these doctors are also struggling with shortages.
We really need about oxygen tank and the refill, and then also the medicine. Because we treat severe condition, so we need remdesivir. Remdesivir, we cannot find it.
Dr. ERNI says the government's data doesn't tell the full story because so many people are dying before they take a PCR test.
We feel so sad because right now there are a lot of lost at home. Sometimes we have people reported to us someone died at home. When we check the body with antigen, apparently positive.
Her team tried to monitor patients in the area, but there are more than 300 of them and only 30 health workers. As hospitals reach capacity and are forced to turn away critically ill people, roving teams of public health clinic workers are trying to reach those in need of medical attention, to monitor their condition and to provide them with oxygen and medication. But there are too many patients and not enough medics, and they don't have the time or resources to help everyone in need. The Ministry of Health says it is trying to increase medical oxygen production and add more beds in hospitals. But each day, more and more people are falling ill.
Because of the situation, very difficult to find ambulance, very difficult to find health facilities. And sometimes when they're reaching the health facility, they already died on the way to the health facilities.
Without even the prospect of getting medical care, people continue to die in their own homes in front of their loved ones. Jessica Washington, Al Jazeera, Bekasi.